Good morning, friends. Today we will go further for the remaining pictures and images from the Australian Medical Council Handbook. So today this picture is seborrheic keratosis. This is most common benign skin tumor of the older adults. Sudden eruption of many, if there are so many such type of the lesions on the skin, then we have to go for the for to rule out the any internal organ malignancies. This is called laser tree sign. So whenever you see the multiple lesions of the skin, then we should keep in our mind that we have to check for the internal organ malignancies as well. So this is the case of seborrheic keratosis. Our next picture is the squamous cell carcinoma of the hand. This is case of dermatofibroma, and here you can see this is benign, and dimple sign, once we press it, it goes in. So that's called dimple sign. There's a no treatment is needed. This is case of dermatofibroma. This is gynecomastia, free, mobile, regular, soft mass. This is case of gynecomastia. If it is more than 5 centimeter, then we have to go for further investigation to check. This is the case of gout. Inflammation of the great toe, that is called podagra. Here we commonly see such type of the questions uh, with the gout, how to differentiate with the gout and pseudo gout. So pseudo gout, you will see in the in question that that will be a positive rhomboid, or as they have mentioned that if it is negative birefringent needle-shaped crystals, that is gout, and if it is positive, then it is pseudo gout. So this is the case of gout. Mostly question comes in the exam with the treatment of the gout. So you have to see the scenario. Either it's asking the initial management, like treat the severe pain if patient is having. So and also sometimes they gave association of gout with the renal failure, chronic kidney disease. So you have to carefully read the scenario, and accordingly you have to select the option for the treatment of the gout. So initial treatment is in acute phase like indomethacin or colchicine. Uh, we choose for the acute pain management, and steroids for the if it is chronic kidney disease. Sometimes intraarticular injections also can be given for the severe pain if we don't have other option for the oral medicines. Or if oral medicines are not responding, then we have to go with the intraarticular injection, but it's only if it is involving the one joint. So this is the case of the gout. This is very important picture. This you should keep in your mind. This is the case of testicular taurian. every time this comes in the exam. So as you can see, if you are seeing that in scenario it's mentioned that acute pain in the young age, like 14 to 18 years of young adults, then uh, if it is option, most probably option would be like to refer to the emergency because emergency of surgery is needed in such cases of testicular torsion. As they have mentioned here that if it is more than 6 hours, then we have to go for the ultrasound. But if it is acute, like you can decide according to the sign and symptoms and the condition of the patient. And then if you have diagnosed that this is the case of testicular torsion, then referral to emergency or refer to operating room. If these options are there, then you have to choose these options. Here you can see the prehens sign, which is when we elevate this scrotum, that will be very painful. So elevation of the scrotum, uh, elevation of the scrotum. So if you elevate the scrotum and then you see if it is painful, it means this is the testicular torsion. But if it is painless, means while elevating the scrotum, patient doesn't feel any pain, then it means this is the case of epididymitis. So this sign would differentiate the either this is the case of testicular torsion or epididymitis. So if it is epididymitis, then definitely the options you have to choose, like you have to go for the pain medicines and antibiotics as well. So this is the classical case of testicular torsion. This topic you should go through because this is a very important topic. This comes every time in the exam. So I hope you would go through this topic and in detail, and you can see the management and the further investigation, how to investigate, how to go for the treatment, which options are there. So you will go through this topic in detail. Our next picture is the basal cell carcinoma. This is the nodular. You will see this. This is the nodules. These are the nodules. So if basal cell carcinoma nodular type, then excision biopsy. But mostly such type of patients we refer for the plastic surgeon. So they have given that if it is these type of basal cell carcinoma or on the face, then we have to if plastic surgery option is given in the questions, then definitely you have to refer this patient for the plastic surgery. So if it is on the face, then you have to refer for the plastic surgery. This is the case of nodular type of basal cell carcinoma. This again a case of basal cell carcinoma, which is neglected, raised age, bleeds easily, telangiectasia. Here you can see this is the case of basal cell carcinoma. You will see such type of pictures in your exam. So you have to go through these topics because the skin cancers, melanoma, these comes frequently in the exam. This is the case of melanoma. Here you can see on foot. So here you can remember the, because melanoma comes frequently in exam, so melanoma, you have to go through this topic in a detail. And ABCD criteria is very important, which is asymmetry, border, color, diameter, and evolution. So ABCD criteria you should keep in your mind. And so this is the picture of melanoma. And if it is sensitive, unsensitive area like on face, then we have to refer for the plastic surgeon. So another case of melanoma. These cancers are very common. Skin cancers are very common in Australia. So they uh, frequently comes in the exam. This is another case of melanoma. So A, B, C, D, E criteria you have to keep in your mind and you have to apply once you go through the exam. This is another case of melanoma on foot. Another melanoma. This is the squamous cell carcinoma of the lower lip. Excision biopsy plus radiotherapy is required. This is a case of ingrowing nail. So today is the last slide of ingrowing nail. Hope you will go through these pictures and images, and also you will cover all these topics. Thank you very much.